There have been some significant and important changes in recent years in how medical data is collected, stored, and used in research and patient care. NORD staff members recently had an opportunity to sit down with two clinician researchers, Dr. Catherine Keegan and Dr. Jennifer Kalish, to get their thoughts on this.
So I'm Catherine Keegan. I am a professor of pediatrics at the University of Michigan of pediatrics and human genetics. I have two appointments at the University of Michigan. I am a pediatric geneticist and I see patients in our pediatric genetics clinic. I also direct our division of pediatric genetics, metabolism, and genomic medicine. And I'm also the co-director of the Michigan Medicine NORD Center of Excellence.
My name is Jennifer Kalish. I'm a rare disease physician scientist at the Children's Hospital of Philadelphia. I oversee a number of programs here, particularly focused on Beckwith-Wiedemann syndrome and other overgrowth disorders that are ultra rare compared to BWS. My clinical work focuses on seeing patients with cancer predisposition and overgrowth syndromes. My clinical research and translational research program in the laboratory focus really on Beckwith-Wiedemann syndrome and on other emerging overgrowth syndromes that lead to cancer in children, really trying to understand the transition between normal growth, overgrowth, and cancer. And some of that clinical research involves writing clinical guidelines and using data from the electronic medical record. And all of this is overseen at CHOP and Penn as adjacent to the NORD Center for Excellence.
We often hear about the growing importance of real-world medical data in both research and patient care. What do you think is important for patients and families to understand about that?
Well, one of the things that's changed the way we practice medicine in terms of the electronic health record and collecting patient data is the use of the patient portals, which I think has really allowed patients to be much more empowered when it comes to their data and their health information, because I think that they have much greater access, much easier access, much quicker access to information about their health. And so, for example, if a patient is diagnosed with a rare disease, they can easily go to their portal and find information about what the name of that condition is and any pertinent information that might be useful for a researcher, or for example, if they wanted to get a second opinion or be involved in nationally based clinical trials, they could get that information right from their portal and use that to again empower themselves to be more knowledgeable about their condition, and also to seek out treatments, whether they're on a research basis or whether they're clinically approved but just not available in that patient's area. So I think that that's a big change that I have noticed.
Medical and health data is really important in both at the individual patient level and in the aggregate. And let's start by talking about the aggregate, which is all of the data together across an entire institution. And one of the things that can help us with is look for trends on the larger scale. And that these trends can either be related to quality improvement, ways we're trying to improve access to care and access to clinical care and research on the downstream side. And what I mean by that, for example, if we want to know